Hi, everyone. Welcome to today's Adult CLL Chapter event brought to you by the HealthTree community for CLL program. My name is Megan Heaps, and I am the CLL Program Manager at the HealthTree Foundation. I'm very grateful to have each of you here for our CLL meeting today and for your support in building this community. I'd like to let you know that today's session will be recorded, and the recording, along with the slides and any resources we'll discuss, will be sent via an email to all registrants within 48 hours after the event has concluded. If you have any questions or comments for us, for our speaker throughout the presentation, please click the chat icon and type them in the chat box. If you are using a mobile device or tablet, you can click the three-dot icon that says More and then Chat in order to access the chat box. So now let's go ahead and get started with today's event. First, I'd like to thank our sponsors who make events like this possible, AbbVie and Genentech. Our topic of today's event is finding financial support and resources for your CLL treatment. So our agenda, first I'll introduce our speaker, Diahanna Vallentine, and then she will speak for the next 30 minutes or so, giving us her presentation. After the presentation, we will open it up for your questions and comments. So let me take a second to introduce our speaker, Diahanna Vallentine. Diahanna is the Financial Program Manager at HealthTree, specializing in financial help for blood cancer patients. As a professional financial advisor and former caregiver of her husband, who was diagnosed with blood cancer multiple myeloma, Diahanna perfectly understands the financial issues facing cancer patients. We're so honored for her to spend the afternoon with us discussing the very important topic of finding financial support and resources for your CLL treatment. So with that, I am going to turn it over to Diahanna.
Thank you, Megan. I appreciate everybody spending their Tuesday afternoon with us. I can't remember what day it is. I hope the weather is wonderful where you are and you're safe and secure in your homes. Today, if you can go to the next slide, we are going to go through some of the resources and opportunities you have to participate in your care and to make sure that we avoid some of the financial problems that can come about with paying for an expensive illness such as cancer. So we're going to help you find out where to determine the cost of your drugs and all the treatment that you're going to be involved in as soon as possible. You need to know your insurance. That is your saving grace. Your foundation of your care is going to be understanding what type of insurance you have and what is your insurance going to pay, and then what you're going to be responsible for. And are there any generics available for the medications or different kinds of treatment plans, whether you take oral or IV, which one is less expensive? Where to find the assistance you need, whether it's through for travel, for utilities, for patient assistance programs, through pharmaceuticals or nonprofits, and how you need to stay organized and keep notes on everything you do, particularly when we're speaking to people on outside references, third parties, such as your insurance carriers or anybody that has to do with your assistance programs. And how will grants affect your deductibles and taxes? That's a really big question that people have, especially going into tax season now. All the money they received last year, how is that going to affect their taxes? And what information do you need to provide to get the assistance for your co-pays, deductibles, programs such as that? And how often can you get assistance? If you have Medicare, can you still get assistance? And where do you go to get help paying for co-pays, deductibles, premiums, and prescriptions? And we're going to show you some other things as well. So let's get started. Next slide. So understanding the cost of CLL. This is it's a moving target, as you all may know. So CLL is the most common form of leukemia in patients greater than 19 years of age and accounts for 38% of all new leukemia cases. In 2023, ASH presented an abstract regarding the lifetime cost of treating CLL with the then current available treatments. It broke down the estimated cost into 1-year intervals up to 5 years. And in their model, they broke down the cost into 5 different categories. Drug acquisition administration was approximately $877,000. Inpatient stays and emergency department visits was $231,000. Terminal care, $20,000. RT management, $3,268. Other testing and doctor visits incorporated the $10,096. for a grand total of 1,142,357. Now, how they came up with that actual dollar amount specifically was the models they broke down, the patients they followed over this period of time. That's quite a bit of money. If you don't plan for, and nobody plans to have an illness as expensive as cancer is, but when you realize you have when that diagnosis come, right then additional planning needs to be put into place. And we're going to break down how some of that works. Next slide. So how do you manage this horrible cost of CLL? So as you can see, the overarching expense is the medications, very expensive medication. So how can you manage the cost of these medications? If you have Medicare, Medicare Part A will cover your inpatient hospital stays, inpatient cancer treatments, some home health care. Part B will cover doctor's visits, diagnostic tests such as bone scans and x-rays, and some drugs that are taken orally, not drugs that are taken through IV. You may need other services that Medicare will not cover, and there may be limitations on the treatments. And when you go through treatments, a lot of you may have found that that is indeed the case. Next slide. So you may need other services that Medicare won't cover. Some of those things are more frequent blood tests, deductible or copays. So know your treatment plan, your current treatment plans, and the possible next steps if you break through this type of treatment. So if you know that your treatment may be changing somewhere soon, know what the cost of that's going to be, know what the treatment plan is going to be, and then make sure that when there's an opportunity to possibly change into other insurances, that you can do it on a timely basis so you won't have any gaps in coverage or gaps in treatment. So plan ahead for your treatment coverage by understanding your insurance and making changes when appropriate, when you're able to do so. Next slide. So the most important thing you can do is make sure you have the best coverage you can afford. And I said that you can afford. Then understand your prescription coverage. For private insurance plans, get a copy of your plan documents. Very important. It's a booklet that you can get from your carrier and read all of it. It's going to talk about the small parts, what they will not cover, how often they'll cover certain types of x-rays or scans. If you're on Medicare, understand the new costs associated with coverage as well as deductible items and out-of-pocket max. Now, the last couple of years, there's been a lot of changes in Medicare, and there's going to be for 2025, yay, something's been on the horizon forever that's going to benefit millions of people, is the max out-of-pocket is going to go to $2,000. That's going to be very, very important for people to understand and so they can take advantage of the right types of insurance. Getting things in writing from insurance carriers when they have a promise to pay for a procedure or inpatient or outpatient, your responsibilities, keep records, note the person you spoke to, the date you spoke to, the time of the day, and what you spoke about. Keep all of those in records, right? Because if you need to appeal a medical decision or a promise to pay decision, you're going to have something to refer back to. Do not pay bills without an itemized bill to compare to the evidence of benefits that you're going to get after you have a procedure or doctor's visits. They're going to send that to you, and you need to compare it with make sure that's actually what actually happened. You'll be surprised at how many bills are incorrect. Over 85% of medical bills, especially for hospital in-stay bills, are incorrect. If you're responsible for paying 5, 10, 15, 20% of a bill, and that bill is like $100,000, $20,000 is going to be yours. And what if that bill is incorrect? Usually the bill is incorrect on the behalf of the hospital, not to your benefit. So challenge the bill, and there are resources available to help you challenge those bills. Who can do those things on your behalf for every bill over $500 that are incorrect? Next slide. So determine the cost of your prescriptions. What prescriptions will you be taking now, and what do you think it might change to in the near future? You can check online for the approximate cost in your area. And remember, the cost can vary between drugstores, and there's a Walgreens and a CVS. They're always on opposite corners or right across from one another. It's really interesting how they do that to compete, but you'll be surprised at how the prescriptions can be different, the cost between those two pharmacies or in that a pharmacy down the road. Don't forget to use prescription cards. I find a lot of people don't think those things are really valuable. You'd be surprised. Sometimes the prescription cards can cost less than if you run it through your insurance. But there is a thing that you need to do. You need to make sure that if your pharmacy when you go into the pharmacy, ask them to run that prescription card. You can pick them up there. Sometimes they have extra ones behind the desk. You can get online and fill out for NeedyMed, RX Assist, or GoodRx, and then they'll run that first. If that cost seems better than your insurance, then they'll be better for you to use first. But they have to run that NeedyMed card first before your insurance. Go out and get those. They're free. They're not insurance cards, they're prescription discount cards that could be very beneficial to you for all of your medications. Next slide. So one of the big things that you should be aware of are there generics or biosimilars that are available versus your brand name drugs? They're going to be generally less expensive. So ask for those when you're talking to your doctor and see if you can do those things, especially if you're having a lot of copays, a lot of deductibles on your medications. It's better to go for some of those biosimilars because they're made to give you the same results as if you were taking a brand drug. Next slide. So as you know, medications for cancers are very expensive. In fact, cancer medications are some of the most costly for any disease out there. Again, the first line of defense is in managing the costs that you have to be responsible for is to review your insurance every single year. Even if you feel like you've done well the last year, insurance plans and insurance coverage does change. Many carriers change cost sharing every single year. So I repeat this every time I'm on a webinar. Make sure you review your insurance every year and make changes as necessary. Review option for assistance from nonprofits such as LLS or HealthWell very, very frequently. Last year, there was a lot of time where there was no resources available. They went through them really quickly. In fact, this year, LLS for some of their programs have reduced it from, I think, 12 or 13,000 down to 5,000 this year. That's a huge cut. And they're open. So you need to go in there. If you have not submitted a request for a grant, go in there and do it now while they're still open. So you can also go to our financial resource center, go to HealthTree's financial resources that you can go through healthtree.org, go to coaches, go to financial resources, and find links to give you help for not just medications, but also for rental, for food, for travel, all kinds of assistance that you may need. And so don't forget to reach out to your pharmaceutical company who manufactures or distributes those medications. Many of them have patient financial assistance programs that can help you pay for your medications. I have listed them on that financial resource page that we have. And there's some on the end of this presentation that are specific to CLL medications. Next. So other areas that you can get help from. Most hospitals, especially nonprofit hospitals, are mandated to have a charity care program. That charity care, it should be offered to patients who need financial help. In fact, most people aren't aware that they're out there, and unfortunately, some of those hospitals will not let their patients know. So you need to ask your social worker, ask whomever is there to get you on that charity care. The charity care can allow those costs that you are now facing to be either free or reduced. Check to see what help you've been qualified for prior to a procedure being done. That way you'll know what your out-of-pocket cost is going to be. You could have payment plans or discounted costs, everything set up so you won't have to worry about that later on. So this can be especially helpful for expensive procedures such as transplants or inpatient treatments. There are also interest-free repayment plans. See if your healthcare facility can negotiate a payment plan with you and ask for a payment plan that charges little or no interest. Now, I know it's very, very easy to go have a hospital procedure or treatment, and you're going to get that bill in the mail, and you don't want to open that envelope. You have to open the envelope. Ignoring it is only going to cause you financial stress and heartache down the road. And then you end up going to creditors. And even though bills aren't supposed to show on credit, that's only bills that are $500 or less. So you can still be on the hook, and it can actually affect your credit. That can affect your financial picture long, long down the road. So open those things up, talk to your treatment facility and see if you can get a payment plan to stretch those bills out. You want to stay in good graces with them so you can continue to get treatment there, and they want you to come back. Negotiate a lower fee. In some cases, a lower fee can be negotiated by the healthcare professional or someone collecting on your behalf, like even some of the collection agencies will help you lower your bill. Ask if you can negotiate the amount that you owe. If you have a $500 bill, say, I really can't afford this, but if you can't do a payment plan, $5, $10 a month, maybe you can say, all I have is $200. Can I pay that? And have the bill be written off. Be aware there are options, but you have to ask. Next slide. So again, many pharmaceutical companies offer additional support for patients. Be aware that they have criteria for assistance, and it varies between the organizations, between Bristol Myers Squibb or AbbVie. Some may not provide assistance for Medicare patients, but I would encourage you to ask. There is one company, Bristol Myers Squibb, that brought Celgene, and the way they had their organization set up were different. Now you have to say, I'm a Medicare patient, I'm under or uninsured with all that, and I need assistance, and they'll transfer you to that particular area, but you have to ask. They may also have income gaps that you have in your household income gaps as to assistance availability. So if you're generally over 500, 600% of the federal poverty level, then you may not be able to get the assistance that you need, but there are other resources available. Some pharmaceutical companies may provide medications to bridge the gap between insurance coverage to help you get on treatment as soon as possible. So if you need the medication, the doctor says, I want you to start this medication this week, and I mean, they want you to start it, call the pharmaceutical company. If your insurance, not sure if your insurance will pay it, or you have to go through pre-authorizations, call the pharmaceutical company. A lot of times they can get you on that treatment while the insurance issue is being taken care of. Talk to the oncology nurse navigators. They are your best friends when it comes to negotiating or maneuvering in that space, and they may be able to help assist you getting the assistance that you need from whatever resources available to you. Next slide. When you receive financial assistance from nonprofits such as LLS or HealthWell, for the orphan and pharmaceutical company to help you cover the cost of medication, no matter how much they give you, it is tax-free to you. You do not have to claim it on your taxes. Therefore, you don't have to report your taxes. However, the funds you receive do not count towards your deductible. So if you have a $3,000 deductible and you get a $2,000 grant, your $2,000 grant, you can use that grant. You don't have to pay taxes on it, but your deductible has not been reduced any. It's still at $3,000 until you start reducing that from your out-of-pocket money funds. Next slide. So again, keep notes on everything about whomever you spoke to, about the promise to pay, that they're looking into it. That way you can call back if there's a question, and you can have everything you need to refer to. Keep a binder with you with all your insurance information, along with your bills and those evidence of benefit coverage, what they're saying they're promising to pay from your insurance. Make sure your bills are correct. If you have any contact with providers or your insurance carrier regarding the cost of treatment, including prescription charges, make a note again as to whom you spoke to, the date and time, and the nature of your call. If you receive any grants, keep a notebook of whom you received it from and the date and when it can be renewed. That's very important, especially when funds are becoming harder, sometimes it's scarcer to acquire. Also note as to how the funds are being spent. Is it being spent on your co-pays or deductibles, or is it being spent on insurance reimbursements for your premiums? Make sure you know how those funds are being used. Next slide. So how often can you get financial assistance from nonprofits? Usually every 12 months, and it's not from January to December. It's whenever you apply, and when you're accepted, it goes for 12 months. And again, acceptance is dependent upon available funds from that particular facility. Check back often. Sometimes they open up during the year. Sometimes they may be open for a few days or a few months, but you need to check back often. You can also apply to more than one organization at a time. I hear a lot of people saying, I didn't know. But you can. Let's say you went to LLS and they do copays, deductibles, all those things, but they also help you reimburse you for premiums you pay for your Medicare premiums. Use it especially since it's gone down to $5,000 this year per grant per patient. Perhaps use that one for part of your expenses. And if HealthWell is open, use HealthWell for some of the other costs, out-of-pocket costs you may incur. If funds aren't used in a timely manner, which means they may say you have to submit claims every 30 or 60 days, you may forfeit that remaining balance. So make sure that once you get that card, you're using them appropriately. You can still apply for the next year. Some financial assistance programs may be a one-time grant, such as funds for urgent need or Catholic charities. Some of those things, they may be just one time, but others may be approved every year. Next slide. So what kind of information are you going to need to provide to those nonprofit organizations or to the pharmaceutical companies in order to get the assistance you need? They have their own criteria. They may require you to not be on Medicare, or you must be on Medicare. They're going to require verification of income, and they may require you to send a proof of income to them. They'll also need to verify that you are currently on treatment. So they're going to send a form to your doctor, and they're going to need your doctor's name, the address of your doctor, and their phone numbers, and a fax number if possible. They're going to ask about the type of insurance that you have and you're using. And if you think your income is changing during the year, let's just say you were working all last year and your income was significant and may not qualify for any of those grants. If you anticipate your income for this current year or later on the year being reduced because you're going to have in-hospital stays for, let's say, a stem cell transplant, you're going to be off of work for 3 years, 3 months, let them know that, because they may be able to reduce that income requirement base because of the current changes you have in your income. Next slide. So this is where you need to be aware of the criteria for applications you're applying for. When you have Medicare, can you still get assistance? Some pharmaceutical companies do not include Medicare, or they have a separate division that can assist Medicare patients. And I spoke about that earlier. Always ask. If you're turned down, ask what's available, what's available. Some pharmaceutical patient assistance programs require you to exhaust nonprofit grants, such as LLS or HealthWell, prior to reaching out to them. And this may probably continue because all the changes with prior authorizations and how things are paying out for Medicare beneficiaries or beneficiaries. There's a lot of things going on. There's a lot of legislative changes going on. So everyone needs to be aware of what's going on so you know what assistance is available to you and then apply. Nonprofit organizations have benefits for Medicare patients that may not extend to private pay. So one may offer for private pay insurance, insurance carriers like through your employer, and one may do for Medicare patients only. So make sure you're applying for the right program, and make sure that you ask for any other programs that may be available if they turn you down for a particular one. A lot of companies also have in-house case management programs. LLS has a case management program where they can refer you to organizations that is not even theirs, that can help you find the assistance you need, even on a local or state or local basis. Next slide. So when to apply, like I said, unfortunately, some of those grants, many of the grants run out mid-year or early in the year. So check back all the time. They may be opening up as they get more funds in. Because they'll need to send a verification of treatment to your doctor. There's that time lapse between them sending it to you and your doctor getting it back. Those funds are not held in reserve for you. You need to make sure that you call your doctor to let them know that form is coming in so they can return it as soon as possible. Next slide. So there are pharmaceutical company patient assistance programs. I've gone through and listed a lot of these out based on the type of medication. Like you can see the Gazva, the Rituxan, the Venclexta, all of these names are really interesting where they get those things. Venetoclax is easy to say. They have the telephone numbers, the links to go out and ask to call them, to reach out to see if you can apply for some of those programs based on your medications. If you go to the next couple of slides, give it a second on a few couple other slides. Calquence, copay savings programs, AZ and Me prescription savings programs. All of those are there to benefit you so you get on treatment, stay on treatment. And if they don't say they have a program to do the bridge between you getting on your medications and then getting your insurance to approve it or prior authorizations, they still may be able to have programs to help you. Next slide. Here's another one for Perkinsa. Some of them also, most pharmaceutical companies have a educational resource program to talk about what the medication is, maybe possible side effects, medication interactions with other medications. They have a lot of programs available. Just get online to their website and then ask. They may also have free medication for eligible uninsured or underinsured patients. You can have Medicare and still be underinsured. So I would encourage everyone to reach out and take advantage of the opportunities that may be available to. Make sure that you can get on treatment, stay on treatment, and not become financially stressed as a result of the cost of the treatments you have. Next slide. Imbruvica, here's some additional assistance. They also work with Johnson & Johnson Patient Assistance Foundation. So here's some great resources available to you. Next slide. I can't say that one. They call it Pyreca copay savings programs through Eli Lilly. Go out and reach out to them if you're on this medication. So where to find us additional resources? And when I say additional resources, it's for other nonprofits like LLL's HealthWell, Cancer Cares. All those organizations have assistance for you. You can reach out to these links. There's also the Patient Advocate Foundation also has a resource that is disease specific and state specific in their education resource library. So there's a lot of organizations out there. There's a lot of resources to help you with utilities, mortgage, rent, food, transportation. There are for ground transportation or air transportation, so you can get to and from your medical treatments or your doctors. And some of them will give you flights for 1 to 3 hours of flight. That's almost across the country if you need to go see a specialist. So there's a lot of resources out there. You just need to ask. Just ask. Next slide. So, in summary, no matter what illness you have, your best foundation is to make sure you have the best insurance coverage that you can afford, and then check it annually. Then, when you find out you have the right insurance, put together a budget that's going to show you where your out-of-pocket is going to be if you anticipate additional treatments, where you start saving, maybe they'll set aside $5, $10, $15 to pay for some of those unexpected costs. Make sure you ask your doctor what changes may happen with treatment in the near future. Ask up front about all the costs of treatment, including your labs, scans, medications, doctor visits, whether they are local or if you have to go to a different doctor or a different specialist. Make sure you get those things and they're actually covered under your insurance. Keep a record of everything, including approvals for assistance, so that if you have any questions, you can go back and have a resource to go back to find those. Be aware of surprise changes mid-year to Medicare Advantage plans. Usually those things, the information is coming out with Medicare changes. Usually you start hearing an inkling of it about July, August, September. It's all laid out. They may wait till the last minute to put it out to you, but they're giving you inklings of what's going on with Medicare Advantage plans. I will lay this out to you though. Medicare Advantage plans are getting a bad rap. Unfortunately, there are a lot of bad players who are selling Medicare Advantage plans because their premiums are cheap, but what you're paying for is what you're getting. If you're paying for little or no cost for a premium for a Medicare Advantage plan, you're getting very little coverage. They're trying to sell you on vision and dental and hearing. Those things are great, but your high cost things are your Medicare, your medical when you have an illness. So be aware of those. A lot of Medicare Advantage plans are also dropping those through some of the providers. Providers are saying we're not getting paid enough for them. It's taking too long for prior approvals to come in. So there's a lot going on in Medicare Advantage space. Be aware. Check for generics if possible. You can find additional help for utilities, mortgage, rent, travel for treatment, lodging for treatment. Also, childcare while you're in treatment can be found on our financial resources site. And this is a site where you can go find those. Next slide. Now, if you have any questions, I'll be glad to answer any questions. If after this webinar is done and you find questions, please send out a link or a question to me. I will be glad to respond.
Thank you so much, Diana. I really appreciate your help and support with this. So like Diana said today, right now it is part of So it's now time for the discussion part of today's event. Now, if you have a question, feel free to type it inside of the chat box, and we will go ahead and answer those for you. Okay. So, Diana, one question that I had is you stated that with the, let's double check here. So with the charity care at the hospitals, what is the specific title of that? Is that called, is that like a social worker, or what is the title that patients can go and ask their doctor, I want to speak with specific individual who has this title, if it is a social worker, and they can support me in finding, helping negotiate on behalf of the patient, that free service?
Okay, it's really interesting. People hold different titles. I may have wear multiple hats in a hospital system, and it can differ between hospital system and treatment facility. A lot of times you may have your oncology nurse navigator that you will meet generally in your hospital team when you're going to see your oncologist, your specialist. They can actually hook you up with a social worker. The social worker is there to answer and help you navigate the entire system, right? And they can help you with your bills. If you're going to have questions about your bills, even when you first go in, say, can I speak to the person who's going to help me with the bills to find out about my insurance? Because they're going to have someone there who's going to be overseeing all of that. They can actually help you then for, say, I'm not going to be able to cover all this. I looked at my insurance. I'm going to have a lot left over for out of pocket. But
Right.
how can I get assistance with this? They will hook you up with, or they will refer you over to their hospital charity program. And nonprofit hospitals, not-for-profit hospitals have those programs. A lot of times they may not tell you. You have to ask if they haven't offered it to you, but they have those programs where they can help you negotiate your medical bills. And it's the hospital charity program. You just say, I need help with, can you get me the hospital charity program?
Perfect. Thank you
And
so
do that,
much for that.
I'm sorry, do that before everything goes over to collections.
Okay, good to know. Thank you for answering that. We also had a couple patient questions that were pre-submitted. They were not able to attend, but
Okay.
they still wanted to ask their questions and get your input, and then we would, HealthTree would pass those back to them after the presentation. So I have a couple of those. That's okay to ask those.
Okay.
So one of them is a patient stated they have a difficult time understanding the explanation of benefits on their bill. Um, what are the top individuals you would recommend they reach out to so that they can do that due diligence and find out if there are any billing errors? Um, is there like someone within their own insurance company that would they be in charge of going through the patient's bill with them, screening for things, identifying and checking, line items to make sure things are correct, or is that something that one of the HealthTree financial advisors would go through with them? Do you know the name of, like, who exactly would they reach out to for that?
The first thing they do once they get treatment or get a bill, they need to make sure that bill is itemized with the coding, the medical codes on there. Sometimes medical codes are incorrect. Okay, make sure those things are itemized, especially if you're in the hospital. Get you're going to get that before you get your evidence of benefits. The evidence of benefit is what the insurance company is going to be paying, right? And so then you compare as to what was actually done. There are programs, it would not be through HealthTree. They're not going to go through and manage your billing. But Triage Cancer has partnered with a program that help people. There's other resources I can send this out after we finish all of this that help people with bills. If the bills are incorrect, you give them the bill, they go run with it. All right. And they're the ones who will make sure everything is paid correctly. A lot of times they can actually negotiate reducing those out-of-pocket costs in your behalf as well. So I will get that link out to you this afternoon so that you'll know some other resources to help people with managing their bills.
Wonderful. Thank you so much. You're very knowledgeable and it's very helpful. These things can definitely be difficult for patients. Um, so I know that you talked a bit about generics. Another question that a patient had that was brought up previously, that we're going to ask on their behalf. So generics such as venetoclax, Venclexta, they are not sure if a generic is, if there is one. Do you know who would they reach out to? Would that be their pharmacist? Would they ask their doctor?
Usually you ask your doctor because the doctor would prescribe either the generic or the biosimilar.
Okay,
Like one of the big ones for multiple myeloma, there's that Revlimid, and Revlimid there's a biosimilar for the Revlimid. A lot of times when people have these kind of expensive cancers, they know what's coming out because they're really seeking that. You'll ask your doctor, say, are there any generics, or do you anticipate any generics coming out in the future? Because the doctors and the pharmaceutical reps are going to be aware of those things.
that's good to know. And like if patients have, so they reach out to their doctor, they can also contact the pharmaceutical company. Is there a specific website that patients you think can go to see if a generic is going to be coming out? Would that just be Google? Do pharma companies ever list those on their own website?
Pharmaceutical companies may not list a generic coming out because they don't want fewer people to,
They don't competition.
because
That
they
makes
want the
sense.
brands.
Right.
But you can Google, say, is there a generic for this medication? Is there one coming out? You can pretty much find out if one's coming out. People want to protect
Yeah,
those patent rights on their brands, and they want people to be under those as long as possible.
that makes sense. Thank you for answering that. Okay. So, this is a question that I have. You had stated that for additional resources that HealthTree offers, so you are a financial program advisor, with your wealth of knowledge, and do you also have other financial advisors, under you that are coaches here at HealthTree?
I do have other financial coaches that are under me that work with me. A lot of them very knowledgeable. Most of these are myeloma patients. But a lot of, if you know, a lot of the resources for cancer, blood cancers come from the same nonprofits.
Right.
The big change is the only difference is going to be some of the pharmaceuticals are different. They may come from the same pharmaceutical companies, but their programs may be different for that type of cancer. Now, we do have financial coaches who are willing to talk to other cancer patients. So it's not like we give you this information, you're out there to hunt and search. And I would be glad to work with anybody. I've not only had myeloma in my family, I've also had several leukemias. So I would be glad as a first line of defense, because we still don't have a huge community. If you want to speak to a coach, I would be glad to speak with you.
Well, thank you for your willingness and support. Just so that patients and anyone watching this presentation afterwards are aware, if you do have financial questions, apart from the resources from today's presentation, you can also reach out to Diana or her coaches, and they can support and walk you through the process regarding financial questions for your CLL medicines you may have. It's not only myeloma specific, like Diana stated. What is the best method for would you say it is simply just through the is it the myfinancialcoach@healthtree.org email?
Well, I don't know if anybody uses that very often, but if they
Okay.
just go into the website and they choose their disease and ask for financial resources, or I can give you my link. You can reach out directly to me. I'm at Diana@healthtree.org, and I'll be glad to schedule some time with you, and we can go over. And I don't just work with pharmaceutical questions. I help with, if you have questions regarding ADA, FMLA, your type of insurance, how to find the right type of Medicare programs, what the requirements of those things are, understanding savings programs, medical savings program, health savings programs, anything financial that can affect your financial lives, I can help you with, because an illness and the cost out of pocket, wherever that money is coming from, is going to affect everything else in your life. It's going to come from somewhere. And I'll be glad to help you maneuver that space.
Thank you so much. Just so that participants are aware, once again, we'll make sure to include the resources such as Diana's email and the specific links so that if you do want to reach out afterwards to gain that financial assistance and support, but the one-on-one for free basis that HealthTree provides here with our financial counselors, you can gain access to that, because I know that sometimes it's hard to here's my email, but I don't have the link. So we'll make sure to get everyone the links in the follow-up email. Perfect. Okay, a couple more patient questions that I had previously that they wanted to make sure were answered. So something one patient had stated is, where specifically do they go to see if they're private? So they are not on Medicare, they are on private insurance. Where do they go to see if their private insurance covers all of their CLL treatments and medications?
What they'll need to do is call their insurance carrier. There should be a member services number on their card, on the back of their card, and they can call them. They can ask for a plan booklet, insurance plan booklet, and they can ask ahead of time what's being covered and at what percentage.
That's good to know. Thank you. And then in some cases where one patient stated if their insurance denies coverage for a CLL medication, is there some kind of appeal process that they can go through? Do you know?
There is. Once you get a denial, there's usually on that denial form how you file an appeal. I would also, when you have a medication question and you've been denied coverage for that medication, because usually that's something you need to start on relatively quickly, ask your doctor to do a peer-to-peer review. Those are usually done fairly quickly. If it's an urgent medication, you can have them turn around and give you an answer within 24 hours. So I would really ask you to work with your doctor, work with the oncology nurse navigator there at the treatment facility or where the medication was written out for you. Ask them to help you on your behalf, and they can usually get an answer fairly quickly.
That's good to know. Thank you. That's definitely scary if a doctor says, you need to try this medicine, and then we won't.
And that comes again with
Yeah,
the bridging while that's being worked out. A lot of pharmaceutical companies will offer a medication so you can get on treatment to bridge until that insurance company and everything is resolved. Because usually
perfect.
they want you to go through this, use another medication first. But in these diseases, we know that some of those medications this is what the doctor finds medically necessary. And that is a key. Medically necessary has to be written on those things in order for it to be approved.
Perfect. Okay, thank you for answering that question. Um, So one thing that I want to know a little bit more about, you stated that there are other programs apart from these pharmaceutical companies that can help with travel, so or even housing. Um, have you personally worked like individually one-on-one with these patients and found success that it's not just go to this website and maybe, but have you personally or interacted with someone that have found success of for example, a patient that needs to travel to a treatment center for X amount of months to receive, let's say, their infusion or be monitored at the facility while they monitor side effects, right? And that these patient assistant organizations that are helping with housing and with travel assistance, that those are effective.
Yes, I have. In fact, when my husband had multiple myeloma, we've got a lot of help through American Cancer Society, where we got reduced rates out of town. We had to go from Louisville to Chicago for his treatment, for a lot of his treatment. And I have worked with patients as well. A lot of our patients don't have access to the technology. They may have phones and they call, and I can help walk them through a lot of stuff. But there are a lot of programs out there that can give you that travel assistance, whether it's vouchers for or tickets for bus rides, for Uber, funds for Uber, for Lyft, for all kinds of transportation needs, planes, trains, automobiles. All those things out there available. There are assistance programs available for cancer patients. And it's on
That's
our
wonderful.
resources that are available, and they're broken down by category.
Perfect. That makes my heart happy that it turns it from a bleak topic to there is hope and all you have to do is look for it, right? Be proactive.
Hmm.
Wonderful. Okay, let me just double check that I'm not missing anyone's questions. Okay. Oh, yes. Um, so let's say worst case, a patient has like they have medical debt. Is there a way to negotiate medical debt?
Yeah, you can negotiate anything. People don't realize you can negotiate anything that you go to a store and buy. You can negotiate it. You just ask whoever is holding that debt, and as soon as possible, when you realize you can't afford it, don't wait till it goes to collections. Usually it gets more difficult, more people involved. But you can say, I can't afford it. If you know ahead of time before the treatment's even done, when you've called ahead and found out what the cost is going to be at that treatment facility centers, remember it can vary based on center, then you can call ahead and say, I need help. I'm not going to be able to afford this. And your social worker, the patient navigator, financial resource navigator at your facility can help you start those programs, fill out the paperwork for that help.
That's good to know.
Yep.
Thank you so much. Okay, one last scan for questions. Okay. Well, let's go ahead and move forward. I'm going to reshare my screen. Okay. Okay, can everyone see this okay? The Cure Hub? Okay. All right, so something that we here at HealthTree are very excited to share is something called HealthTree Cure Hub. And one more time, thank you so much, Diana, for today's presentation, for answering the pre-submitted questions, and for answering my questions as well about the CLL finances. It's very informative, and we're excited for the beneficial impact that that will give for the patient community. And so moving forward, I'd like to take a moment and mention one of our important programs called HealthTree Cure Hub. At HealthTree, we believe that educated patients and researchers create better and faster cures. HealthTree Cure Hub empowers patients with the knowledge they need to actively participate in their health journey while providing researchers with valuable insights from real-world experiences like yours. Connecting patients and researchers not only accelerates the development of innovative treatments, but also lays the foundation for a future where more educated patients and researchers leads the way to more effective and personalized cures. We invite you to join the 12,000 and counting blood cancer patients who are currently benefiting and impacting their outcomes while accelerating research by participating in HealthTree Cure Hub. So a little bit more about the specific platforms inside of Cure Hub. It's a one-stop platform, provides you the ability to accelerate research by connecting you to surveys and studies submitted by CLL experts. You can securely connect your medical records to track your disease, have a comprehensive overview of your medical history, including diagnosis, genetics, lab results, treatments, all within this single user-friendly interface. You can discover clinical trials personalized to you. Cure Hub will analyze your medical history, your lab results, genetic data, and then suggest these relevant clinical trials that you might be eligible for, expanding your access to cutting-edge therapies. In Cure Hub, you can also find and anonymously connect with your genetic CLL twin matches. We are in the early stages of this process, but over time, there will be more of these CLL twins that you can go and see they would have the same genetic CLL features as you. As well, you can see what treatments they have tried. In Cure Hub, you as well can gain access to a database of side effect solutions provided by other blood cancer patients. And you can also add side effect solutions that you have found helpful for yourself. So you can enroll in HealthTree Cure Hub by visiting the link at the bottom of this slide. I'd also like to mention our next adult CLL webinar will take place on March 18th. We'll be talking about tips for CLL patients on managing anxiety and depression with psychotherapist Anna Sahagun. You can visit healthtree.org/CLL community events to register for this upcoming event. I also, again, want to take a moment to thank our HealthTree community for CLL sponsors, without whom this event would not be possible, AbbVie and Genentech. And thank you so much to everyone for coming, helping us build a strong HealthTree community for CLL. I appreciate all of you, and I hope you have a great rest of your day. I hope to see you again soon. If you do have any questions, don't hesitate to reach out. And we look forward to seeing you at our next HealthTree event. Thank you so much.